The pandemic and its economic fallout are having different effects on different parts of America. The virus itself has hit hard, disproportionately hard, Black and Hispanic Americans. The job cuts in particular are squeezing American women. We want to take a look at the changing playing field in America post-virus and in the part of our recovery where we just don't know what's coming around the corner. To take a look at the gender divide and what appears to be a widening one, we're joined now by Dr. Nicole Mason. She is president and CEO of the Institute for Women's Policy Research. Dr. Mason, thanks for joining us.
Thanks for having me.
This is such an important topic to understand the faces, the stories, the experiences behind the numbers. Why are women, in particular women of color, being so disproportionately affected?
The reason why women of color have been disproportionately impacted by the number of job losses over the last few months is because they're disproportionately and overrepresented in service sectors. So that's health, education, hospitality, leisure. Those sectors have been hit hard by the stay-at-home orders, and it's disproportionately impacted these workers.
So the job cut itself is difficult, but supporting a family, if you are a single mom, the level of difficulty is that much harder. How are people handling this, and what does it look like in terms of the prospects for finding work right now?
So since the start of the pandemic, around there have been 30 million jobs lost, and women have sustained 70% of those losses. So to put that in perspective, in February, the unemployment rate for women was around 4%. Today, it's around 15.7%, and it's higher for Black and Latino women. And many of those mothers are breadwinner mothers, meaning that 40% of their income contributes to their household income. And for single mothers, particularly Black and Latino mothers, they're more likely to be the primary wage earners in their families. So what this means in terms of the job losses is that those women are least likely to be able to make ends meet, and many of them were struggling before the start of the pandemic, and it's only been exacerbated.
So that is sort of a snapshot of the most vulnerable and the most heavily impacted. But for so many families, even women who have the luxury of continuing to work from home have had to turn those kitchen tables into classrooms along with their home office. The balance part of this seems off. What is this doing to women in the workplace, the workforce, and pay equity?
So I'm one of those women. So about 30% of the workforce are able to work from home. Most of the other workers, particularly lower wage workers, many of whom are women, are not able to work. And so what this pandemic has forced women into is this very impossible role. They have the dual roles as wage earners as well as primary caregivers. They're now responsible because of schools have closed as well as daycares have closed. They have taken on the lion's share of caregiving responsibilities, including homeschooling. And a new study that was just released found that, which I don't think is very surprising, that women, working women who are working from home only have about 1 hour of uninterrupted work. They can't go without, they can't go more than...
That sounds about right.
That's about right. Compared to their male counterparts who, have about 3 hours of uninterrupted paid work that they're able to accomplish from working from home. So what this says to me is that women are taking on the majority of the responsibility of care work at home, including homeschooling, but also housework and the other caretaking demands.
So there is this push to reopen the economy, but from what you are painting the picture of in terms of how our society is actually functioning, these women won't have an easy time going back to work, even though some of these businesses are reopening.
That's right. The idea that when the stay-at-home orders are lifted, that we're just going to go back to 100% is just a fallacy. What we know is that there will not be one-for-one replacement for all those jobs lost. So if we lost 30 million jobs, we're not going to, when we lift the stay-at-home orders, everybody goes back to work. That's just impossible. And we also know that for a lot of families and a lot of women workers in particular, if the daycares are closed, schools are closed, summer camps are off, those women will not be able to enter back into the workforce in numbers post or pre-pandemic.
So what is the policy prescription to fix this problem? Is there one?
Despite high hopes of 100% employment and the economy snapping back, it's just not going to happen. This is going to be a slow recovery. So some of those policies that we saw as relief efforts should be institutionalized, like the expansion of unemployment insurance, the stimulus checks, some other supports to help women, especially vulnerable women or lower wage workers who have been hit hardest by the pandemic, to help them ride out this economic storm.
These hardships you're describing, do you think it's changing the political calculus on making some of these adjustments more permanent in terms of paid leave and some of the flexibility that you're saying is needed right now?
Yeah, so I hope so. I hope so. So just before the pandemic, many of the policies or the relief efforts that we've now implemented, we said was impossible. We couldn't do. So paid sick leave, basic income in the form of stimulus checks, expanded unemployment insurance for workers who are part of the gig economy or who are part-time workers. We said that was too costly, but we did it. And so what is going to happen as we move forward is that we should think of ways to institutionalize those practices, because what we know is that they work for working families, and we need those kinds of supports right now more than ever.
In short, the economy can't get back to full steam ahead until there's some kind of childcare provision. It sounds like that's what you're saying.
We're fooling ourselves if we think that when the stay-at-home orders are lifted, the daycares were open, childcare centers will open, and schools will open. That's just not going to happen. So what we need to make sure that working women are able to return to work is that we have childcare supports, subsidies, and other kind of provisions. Other than that, it's just not going to happen.
I know you said you're working at home. I'm working at home, dealing with kids and all the things that you have to juggle. It's a difficult thing, but it's not impossible. Do you think it changes employers' appetite for women or other employees continuing to work at a distance?
So what I'm hoping is that whatever was normal before the pandemic, we won't go back to that. Because many women workers, including myself, we were juggling so much. We were, again, had the role of wage earner as well as the primary caregiver, and it's even worsened as a result of the pandemic. So what I'm hoping is that employer practices will improve around workplace flexibility and policies to support women workers. So in that way, I'm thinking about remote schedules, flexibility, paid sick leave, and also I would like to see some employers step up in public-private partnerships to provide childcare supports in the same way that for other workers we make accommodations. I think we really need to think about what kinds of policies and employer practices do we need to make sure that women are able to not only enter the workforce, but stay there.
Dr. Mason, thank you for breaking all of this detail down for us. It's an important point. We appreciate it.
Thank you so much for having me. And I think we do have a path forward, and it's expansive, and it's really about expanding and increasing supports for working women across the country.